Good afternoon, everybody. My name is Fritz Disk. I am a pharmacist turned doctor, then anesthesiologist, cardiac anesthesiologist. So I get the opportunity to see cardiac disease in a very up close and personal way. Our team runs a foundation where our mission is to power everyone to save a life. Today we'll be using the AHA's Life Simple 7 to save lives, specifically talking about prevention and management of hypertension. That's one of Life Simple 7, and we're going to be focusing directly upon that. So during the presentation, please feel free, raise your hand. There's a little icon over there for that. Type in any questions you have. We'll have plenty of time at the end for questioning and whatnot like that. Also attached is a PDF, more information on hypertension. It's supplied by the AHA. It's an excellent guide, just as kind of a simple overview of high blood pressure. So let's launch right in. So we'll go into the top 10 causes of death in the United States. So just kind of the scope of the problem here. The the first and third most common causes of death in the United States: number 1, heart disease; number 3, strokes, both of which having to do with the cardiovascular system. So there's nothing quite as impactful and terrible upon our health in general than those two kind of combined. Hypertension affects both of those two, so that'll be kind of the topic of our discussion. So in 2010, the American Heart Association announced its new health impact goal. They wanted to improve cardiovascular health, all Americans, by 20% while reducing death of cardiovascular disease and stroke by 20%. That's a pretty lofty goal. So how's the AHA actually, how are they going to actually achieve this? Well, the focus has been upon identifying and adopting kind of healthy lifestyle choices. So for the first time, the American Heart Association has kind of defined what ideal cardiovascular health looks like. Now, there's a ton of information out there, and most of it leads everyone to kind of not really know exactly what they're supposed to do. Egg whites, are they good? Are they bad? What are we supposed to actually eat? We have no idea. So they've identified 7 health factors and lifestyle factors, basically, that support heart health. So we call those Life Simple 7. Improvements in any of those, especially all of those, can greatly impact kind of the quality of life and your lifespan. So not only that, they've kind of developed this online assessment tool, My Life Check. So you can go to mylifecheck.com, and it outlines the 7 goals of ideal health. We'll go through those a little bit later here. It shows you kind of where you are on the path and what you need to improve. And it kind of offers simple action steps that you can take to help live a long, productive, and healthy kind of lifestyle. So being healthy. So research shows now that those who kind of reach their cardiovascular wellness goals by age 50 can expect another 40 years free of cardiovascular disease, so heart disease and stroke. That's a pretty amazing statistic. I was kind of floored when I first kind of heard that one. That's the age of 90, and you're basically kind of avoiding the first and third most common causes of death. And if you take care of a lot of lifestyle challenges, number 2 is cancer, and cancer, 2/3 of cancer-related deaths are related to lifestyle. So you've probably done a pretty good job of avoiding that one too. So today we're going to focus on normal blood pressure. However, you'll see that many of these 7 are all extremely interrelated, interconnected, meaning that by affecting one, you're affecting most all of them. So optimizing one helps almost everything. So this chart kind of illustrates in a fair amount of detail the 7 health factors and health behaviors kind of at a poor, intermediate, ideal cardiovascular health. You may note it kind of has specifics for both adults as well as children. This is directly off of kind of the My Life Check. There's 3 health factors, so basically blood pressure, cholesterol, and blood glucose. And then 4 health behaviors, being physical activity, healthy diet, smoking, and then healthy weight. So again, we're not going to dive directly into exactly all the detail for each one of those factors. We're going to focus on just the one, but mylifecheck.com, an amazing site. AHA does an amazing job of being able to not only kind of track where you are, but give you recommendations on kind of how you can improve any of the certain factors on there. So launching into blood pressure in particular, so hypertension, also known as high blood pressure, single most significant risk factor for heart disease. So that's relatively important. There's nothing that affects heart disease or stroke more than blood pressure, and that's again the first and third. So uncontrolled high blood pressure can injure, kill you, sometimes called kind of the silent killer because there's no symptoms associated with it. You won't know whether you have high blood pressure until it's far too late. 1 in 3 adults has kind of high blood pressure, yet 21% of them don't even know that they have it. Of those who know that they have high blood pressure, only 69% are receiving treatment. And of those, half are actually within the right range. So as you can tell, there's very few people who are actually well managed on their blood pressure currently. So if you're kind of ready to embrace kind of a lifestyle free of heart disease and stroke, one of the best strategies and the number one thing, first thing to do is to know your numbers. You can't judge blood pressure on how you feel and your best guess on how it's going. Like blood pressure has no obvious symptoms at all. It's a silent killer for a reason. So for example, my father was recently diagnosed with hypertension. He started lisinopril, which is a very common blood pressure medication. I set him up with an automated blood pressure monitor, and and he was to take his blood pressure daily, and he was going to follow up with his physician and bring in his logs of his blood pressure measurements, see how everything was going. I asked him a month later, like, how's everything going with the lisinopril? And his response, great, it's awesome. I feel so great that I stopped taking my medication altogether. So there's a good amount of education that kind of comes with kind of initiating high blood pressure medications. It's a silent killer for a reason. You're not going to know. It's not likely that you're going to have symptoms associated with it. If you have any symptoms with response to the actual high blood pressure, it's because the blood pressure has likely gotten far too high. At that point, you're getting headaches. You're close to a stroke at that point. At that point, you're far beyond the time of being what we call optimized. If anything you get from the medications, it would be some sort of a side effect. All the different classes of medications have different side effects, so if you experience a side effect, you don't really want to take the medication, especially when you're taking the medication for something that you didn't have any symptoms for to begin with. So that's why a lot of times just the awareness of how challenging high blood pressure can be for your health can be super duper important for everyone. So, how to understand kind of blood pressure readings and levels. So, first step is, like I say, knowing your numbers. So, what do the numbers mean? High blood pressure is always kind of read as a ratio, okay? And the words associated are systolic versus over diastolic. What systolic means, like what is that anyway? So if you're thinking about like what blood pressure actually is, your heart is the pump that pumps blood around your body, okay? So as the heart squeezes, the pressure inside your arteries is going to be at its highest level. So that's the top number, and the top number will be higher than your bottom number. So when the heart's squeezing, that's what the pressure is inside your arteries at that point. When the heart relaxes, that's when the diastolic pressure is measured. That means what's the pressure while the heart's actually relaxing and in a relaxed state. Because when it's relaxed, it's not as though your pressure goes to nothing. At least it certainly shouldn't. It'll still be at a certain level. So those are the two numbers that we refer to, and they're read in milliliters of mercury, which is just relatively an arbitrary term for most people. That's what we in healthcare. That's kind of how we measure that. So systolic versus over diastolic. That's kind of the numbers that we're going to be talking about when we're talking about kind of our levels. So the AHA has blood pressure guidelines, kind of telling people, okay, so when you get your blood pressure checked, what does that actually mean? Is it normal? Is it a little high? Is it real high? How bad is this? So They have different categories. So basically 5 different categories. You have a normal pre-hypertension, stage 1, 2, and then a hypertensive crisis. So hypertensive crisis is where emergency care is necessary. We want to catch things before it gets to that state at all. Again, you probably won't have symptoms until it gets to that level. So it's important to kind of treat that prior to you getting to that point. So how we actually treat that, how we actually know that that's actually happening. There's 5 simple kind of steps to kind of control your blood pressure. Again, number 1, most important, know your numbers. You need to know where you actually sit, and that needs to be done more than once. So you need to check it a few times. So you'll check it at least once a year with your healthcare professional as you're having your checkups. Okay? Any measurement twice over a certain level, you're going to be diagnosed with high blood pressure. You're going to need to do some modifications of some sort, and your physician will kind of work out or healthcare provider rather, will kind of work out the treatment algorithm for you. And that's where number 2 comes in, making a plan. You just have a plan for kind of what needs to be done. That doesn't always have to involve medications. Often people think of medications to control, but there's definitely lifestyle changes that can certainly help facilitate the decrease in blood pressure. So they have them broken down into 5 different things here, okay? A lot of them have to do with the other Life Simple 7, like lose weight. It's actually another one of the Life Simple 7 on its own, as well as eat healthier and remaining active. So you have 3 more of your Life Simple 7 that are incorporated into just controlling your blood pressure. So again, there's a lot of synergy with all of these things. So diet, exercise, that we've kind of heard multiple times, those ring true here as well. The additional things that are associated here, reducing sodium, staying under 1,500 milligrams a day shows to a really great reduction in blood pressure. I see this pretty often when I travel abroad. Depending on diets, you can have diets that are pretty high in sodium, especially third world countries and whatnot like that. With the increase in sodium, you can find extraordinarily high blood pressures outside of normal. The other factor is limiting alcohol. No more than 1 to 2 drinks a day. That's 1 for women and 2 for men. Alcohol is shown to increase blood pressure. Again and again, all studies kind of pointing in the same direction for that. Okay. The 4th thing, checking your blood pressure at home. This is super important. There's this phenomenon called the white coat syndrome. So when you're taking your blood pressure at a doctor's office, it has a much higher tendency to be higher at that point than it does at any other time period of you actually checking your blood pressure. So having the ability to check your blood pressure at home in a reliable way, same time each day, same position, sitting down, taking it at the same time each day, shows you where your blood pressure is on a pretty regular basis. That is super important to do in order to track how you're actually doing and to share those with your healthcare provider. And number 5, if you need to take any medications, then you're taking medications kind of as they're prescribed, following up with a healthcare provider as needed to help control those. So those are the 5 kind of simple steps to kind of help control blood pressure as you kind of have challenges here or there. So with that simple success plan, kind of every step kind of counts toward the goal. So we're kind of building a healthier future, just one heart at a time. So hypertension, pretty terrible challenge throughout the world. However, not something that we can't help to both prevent and manage. So with that, I wanted to open it up, have plenty of time for questions. Please, anyone, throw your hand up. If you raise your hand or throw a question, I'll be able to kind of know and I can ask you. Let's see. So here we go. Sorry. So Trudy Bondi. Trudy, do you have a question that I can answer for you?
Can you hear me?
Yes.
Yes, I was wondering if the smartphone applications that say they monitor your blood pressure, are those accurate? What are your thoughts on those?
Yeah. Um, you know, that's a fantastic question because I I'm kind of a tech nerd. I absolutely love the fact that those are becoming available. To my knowledge, there's none that are approved by the FDA currently. So the challenge with those is that the technology is getting better all the time. There's even a company right now that is doing something even cooler. I think it's called Xanadu, that actually has a patch you put on your chest, and it's 24-hour monitoring. I think it lasts for 7 days if memory serves. 7 days where it does everything from respiratory rate, heart rate, and your blood pressure continuously. Now that's completely and totally cool and interesting. The apps, I'm not sure that they're quite as far as they need to be in order to be FDA approved as being reliable yet, but I have a lot of confidence that they'll get there. The really cool thing with technology and those kind of applications that will help compliance in a very large way, meaning that your results can be routed directly to your physician, directly to healthcare providers. So your healthcare provider can know your numbers, know what's going on, and really be able to in real time be able to help you with adjustments. Now, when you get to 24-hour blood pressure monitoring, now you get even more data. Like at this point, we don't even know what normal blood pressure is whenever you measure it for normal people as you're walking around on a 24-hour basis. We've never had access to that. We've never even been able to do that. So that's a whole new area of research that we don't even really know what normal blood pressure is on a 24-hour period for a person that theoretically has no risk factors. Maybe they do have risk factors, maybe they don't. But 24-hour monitoring, right now, we don't really have the capability to do that outside of an intensive care unit whenever we have an arterial line in. So, meaning at that point, you're relatively sick. You're clearly not doing well. You're in an intensive care unit. Um, but outside of there, we don't even know what normal blood pressure is. So, new information, extremely, extremely interesting and cool that's coming down right now. Does that kind of answer your question, Trudy?
Yeah. Yes, thank you.
Okay, cool. Any other questions, Trudy? All good?
No.
Okay. All right. So let's see. Sunil.
Yes, I've got three questions I
Sure.
posted on the GoToMeeting. Can
Yeah.
you see them?
Oh, let me look at them real quick. Gotcha. Awesome. All right, Sunil, let me see if I can pull them up here. Yes, you do. Okay. Indicate the website to help you improve blood pressure. They have two, if I remember right. Sunil, I know that like My Life Check is pretty amazing. There's another one that is on the handout. It has something to do with 360. Forgive me, I don't remember the place in particular, but there's another website that the AHA has that is really awesome as far as improving the website or improving blood pressure, and it has a way to actually keep it all of the time. Is it? I think it's Life Check 360, if I'm not mistaken.
Okay, great, thanks.
Yeah, yeah. And your other one, oh, yep. And you had the one for smartphone apps uses monitor blood pressure as well. Fantastic. Did that answer your question, Sunil, as well?
Because someone mentioned there are some smartphone apps. I wasn't aware of them.
They
So
are.
I know they're not FDA approved, but if there's anything that someone's used with some success, I'd rather go with the smartphone app.
You know, it's tough to know. Like at this point, when it's kind of unapproved by the FDA, it's tough because they haven't been able to show the reliability quite yet.
Okay,
And a little bit of that has to do with the hardware of the phones and whatnot too. So like we're not quite there yet. They're
okay,
almost there, and they even have EKG monitoring. They have a lot of really really cool like apps that'll be available to where there's one physician in particular that's kind of spearheading that effort. His name's Eric Topol, who's from the Cleveland Clinic, but now is out in California, and he's um, like he does mostly prescribing of apps, and he's a cardiologist, and he'll prescribe apps more than he does medications. Um, it's very interesting, very cool, cool type stuff that they're doing in apps right now. Now, there's also maybe you guys have heard of Fitbit. Fitbit is another. It's a company that that does monitoring through kind of a wrist device. Like I wear one all the time at this point. Like they haven't gotten to the blood pressure, but they do have continuous heart rate monitoring.
Okay.
Also steps, that kind of thing, to where it's an activity monitoring. Also, it does sleep. It does a few other things as well. These devices, I think you're going to start to see far more. Like this is a busting field right now. I would say within the next 5, this is going to be very, very quantifiable, and it's going to be pretty ubiquitous throughout the market. So this is really cool. Like this is one of the coolest things within healthcare that I feel is kind of happening right now.
Great.
Cool. All right.
And the last question.
Yeah, please.
It's also written down.
Oh yeah.
My Walgreens monitor has 3 settings. Any idea what those settings are for? It's like 100, 180, 200.
220.
Yeah.
So let me look here.
The instruction manual doesn't talk about those settings. So I'm not sure. Should I set it at 200 or?
It is very strange.
I've got 2 monitors. One doesn't have any settings, which I use, and then the other one that I stopped using was.
Like Sunil, I was a Walgreens pharmacist. I never even noticed that. That may be a new thing. I tell you what, bring that into your. What I would do is to bring that into your pharmacist just to see if that's
Okay.
See what's going on with that. If I had to gut check that, I would say that depending on how high your blood pressure normally is, if you needed it to actually like inflate higher, you can do a higher setting. But frankly, if it has to inflate over 180 for it to get your blood pressure, that's bad.
Right.
So I mean, you know what I mean? So like, that's what I would think offhand. But boy, that seems like it would be a bad deal.
Right.
You need to inflate over 180. You need to go in.
So it's the pressure the cuff exercises on your arm.
That's most likely. That's what I'm betting. You want to double check that just to be sure. But that seems yeah. You want to check for the accuracy just with a healthcare professional.
Okay, fair enough.
Thank you. Yeah, you got it. All right. Okay, so now let's get you here. All right. Renate, let's see here. Hi. I have your question here. I'm on blood pressure and cholesterol meds, and I have my cholesterol in check for many months. However, my doctor wants me to stay on it for my blood pressure. How do they work together? Why can't I get off the cholesterol meds? It's a good question. So cholesterol is in check right now. You're on blood pressure, cholesterol meds. Cholesterol is completely fine. And he wants you to
he won't take me off the cholesterol prescription.
Yeah. So tell me, there's multiple factors that kind of fit in it. Like usually, you won't need it specifically for blood pressure. It depends. Family history may have a little something to do with it. Do you have either a history or a family history or anything like that?
No, but I do know that my blood pressure isn't diet related. I mean, if I get off of my blood pressure pills, my pressure jumps up almost immediately, a day later.
Yep. So it's not, you know what, there's a few factors out there that are not terribly modifiable. One of which, age, another, race, family history, and then there's one other, if I can remember that one.
Okay, I'm African American. I'm over 55.
Neil, you're in a tough spot because like that's
okay.
You know what I mean? Like that's you may have a predisposition to to need help with blood pressure medication. You know what I mean? You could do all of the right things, so to speak, with lifestyle, and still need it. Now, as far as cholesterol meds, depending on which ones, cholesterol meds have also been associated with just lower inflammatory rates all over the body. Okay. Like everywhere, everything from like decrease in Alzheimer's, bowel, cardiovascular health in general. So it's been shown to kind of improve cardiovascular health, even with you having kind of cholesterol that's kind of in check. And if you went off of it, I'm not 100% sure, but like your doctor would know kind of if your cholesterol is completely okay, even with you off of it. It sometimes can be used for what they call off-label reasons without like without actually needing it for cholesterol.
Okay.
Does that make sense?
Yeah.
Yeah.
Thank you.
Oh, you got it. All right. Okay, let's see. Reno. Okay, Reno, are you available? So, Reno, I have a question from you. Do you know what causes high blood pressure? What triggers it? Are you available, Reno? I think I unmuted you. If not, I can go ahead and just launch in real quick. Biggest causes of like high blood pressure in general. Let me see if I can kind of pull it up on the thing here. Oops. No, let me see if I can get this. So, biggest things that we have that kind of control blood pressure, are the things that are kind of modifiable. So, what triggers high blood pressure in general? Usually, diet, exercise related. There's also, like I say, like all those factors that have to do with just your non-modifiable blood pressure type challenges, such as age, race, lifestyle, genetics, all that kind of stuff. That plays in to kind of what causes high blood pressure in general. Now you have other things that we kind of haven't talked about yet, such as stress. Stress is kind of shown to be like another pretty large area within um, kind of blood pressure challenges. Everything from pain, like emotional stress. That's why they even found like things such as even meditation, yoga, whatnot like that, as being able to help kind of decrease and lower high blood pressure in general. There we go. I think we got you here. Okay, and see who the next person is. Nicole. Nicole, are you there? So Nicole, I got your question here. What foods do you need to avoid that are high in sodium? Absolutely great question. What foods help to lower blood pressure? So there's a few things that have to do with both here. So for avoiding, like the kind of key things in the way of avoiding would be processed meats. Anything that's basically processed is pretty much laced extremely highly in sodium. Um, That's why they say like what's the flip side of that? What foods actually help to lower blood pressure and lower well, cholesterol fits along with it as well. Unprocessed raw vegetables, fruits, vegetables, um, kind of low fat proteins. That's kind of on the when they say like kind of eat healthier, that kind of stuff. That lesser processed meats when you have them definitely help in every way. What kind of things to avoid? Anything that's been heavily processed, like hot dogs, sausages, anything like that. Those are the things that you can catch a lot of sodium in really quickly without even kind of knowing it. Other things they can kind of be hidden in things such as like tomato juice, or example V8. I think you do a really great job with V8. Go for the low sodium V8 or the low sodium uh, type beverages. You can fit a lot of those inside a lot of things that you're eating. So you want to. So basically, when they talk about going around a grocery store, you want to kind of shop around the outside as opposed to the inside of the grocery store. So the aisles around the outside, kind of bordering the grocery store, is usually the best way to go when it comes to doing that. I hope that answered your question. If it didn't, Nicole, please just holler out and let me know. All right. So, Marty, let me take you off of mute here, Marty. Actually, I can't find you on here, Marty. But let's see here. So, Marty, how much benefit does hawthorn berries work for lowering blood pressure? Many patients who want to use more natural methods before medication. I 100% understand. Actually, what got me into medicine in general was that my father was really, really into natural remedies. He loved to use any natural remedies that were over the counter to help any ails that you possibly would have. So I got really interested in that and thought that was just completely and totally amazing. So it took me into pharmacy school to kind of learn a little bit more about it. So we went into pharmacognosy, which is actually like the study of plants being derived into medications and being able to be used in medications. Since that point, after researching a little more, my views on that have changed a little bit. As much as I love and agree with completely like eating a lot of like raw foods to help out with everything from lowering blood pressure, just as Nicole had kind of asked before, being able to do like kind of hawthorn berries work at lowering blood pressure. Like large pharmaceutical companies get a lot of bad rap, and not for completely and totally horrible reasons all the time. But one thing they're pretty good at is their business. If there's something within hawthorn berries that they can reliably show that decrease blood pressure in a reliable, good way and doesn't cause an increase in side effects beyond the point where they already are, like beyond any other medication, I promise they will market it and they will sell it. They'll have your insurance cover it, and then they'll make a lot of money. So very basically, if there's anything on the aisles right now that's not back in a pharmacy, it's because they can't reliably do that. And it's not as though they haven't tried. It's not as though like they haven't learned about hawthorn berries. It's not as though Pfizer doesn't know about St. John's wort. It's not as though like they don't know about a lot of like saw palmetto. They're fully aware of those things. So for me, there's a large placebo effect, and that's kind of the effect that kind of happens when like I said, I'm sure you kind of know like when people are taking medications yet there very well may not be anything actually in the actual medications at all. They still experience the positive effects associated with the treatment. I feel like a lot of the over-the-counters, which I was a huge fan of, I feel like that's kind of more of their mainstay of treatment. Now, if that works for certain patients, and if they believe that hawthorn berries are what's causing their blood pressure to decrease, and when they get their numbers and it is lowering their blood pressure, I'm not sure I can tell them that that's wrong. Because one way or the other, their blood pressure is down. As long as they're not experiencing any side effects, I don't really see a huge problem with it. At the same time, recommending hawthorn berries in order to lower blood pressure, you're banking on more of a placebo effect than you are any other effect when you actually utilize those. So that one's a tough one because I hate kind of crushing people's hope on natural remedies working terribly well. And some, I mean, they'll have a lot of support behind them. But usually I feel like it's a lot of marketing. It's not a whole lot of everything else that's kind of associated with that. So Marty, hopefully that answered your question there. All right. See if I got up. Nice. All right, let me find another one. Okay, Nicole, I got a different question from you. What supplement or natural alternative treatments would you suggest? I think let me know if we didn't just cover that, Nicole. I'm going to unmute you just to make sure that I didn't. Nicole, you've been unmuted in the event that you have more follow-up that you want on that one. But I don't know that I would suggest any really offhand, really, at this point. And Thomas. So Thomas, I have some questions from you. Let me find you real quick. All right, you've been unmuted, Thomas. Let's see here. Late to the webinar. It's having some issues with the activation and a copy of the slides for your review, for my own review. Absolutely. Thomas, are you available to chat? Okay. So yeah, no problem at all, Thomas. What we can do with that, we can absolutely do that. All you have to do, I'm going to put on, you can go ahead and email me. My email is carl.disc, so Karl.disc, DISQUE, at discfoundation.com, or .org rather. And you can just email me over. I can email you, I can email it out, and I'll also make it available for Nicole, who put this together for you guys, and that way you guys can, you'll have it available. So that shouldn't be a problem at all. So Thomas, you had another question, also as a follow-up with the sodium question. You take lithium. I was wondering, additional risks, have to mitigate them since already on blood pressure medication, no lithium affects sodium levels. Yep, may interact with many medications. You're absolutely correct. So when it comes to lithium, and kind of as it fits in with blood pressure medications and basically any other medications. So blood pressure treatment very, very, very rarely happens in a vacuum, meaning that that's the only challenge that people have, just blood pressure challenge. In other words, there are a lot of comorbidities that happen in the way of hypertension. So very often you'll see coronary artery disease, you'll see perhaps diabetes, you find obesity, and COPD. There's multiple things that come along with it. So as you add medications, say for example like lithium acts directly on sodium channels. So there are a lot of things that affect. There's just a lot that actually do that. So like everything, whenever you're adding on different medications and trying to control, everything is a risk versus benefit. So when it comes to kind of being able to kind of see where lithium kind of falls in, or how your blood pressure medications, which ones exactly, and how they kind of fall in with lithium, and how diet works that out, that's a very personalized choice by like the physician or healthcare team for that one. So I hope that answers your question, Thomas. If not, just please. Oh, sorry, you need to unmute. Got you. So Jim, Evelyn, let's get you here, Jim. Okay, Jim, are you there? All right, I think I got you there. So, plant sterols in products like True Heart, Bear, and help lower blood pressure and cholesterol. So, plant sterols, those have gotten a lot of good. Those have gotten a lot of good publicity throughout the last 5 to 10 years. I don't know how much they actually help to kind of lower blood pressure, cholesterol, that kind of thing. I think again they're kind of they can show studies showing both ways. So it's certainly nothing that's very definitive. With them being plant-based and sterols and whatnot like that, it gets a lot of benefit of the doubt. So a lot of people think that like it's plant-based, you should be good to go. Bayer's endorsing it. The best thing with Bayer, of course, is they were the original people who introduced like aspirin to the market, and aspirin's definitely fits into the algorithm on how to treat coronary artery disease. And again, right when I was talking about like inflammation, aspirin's been shown to help out in inflammation in a lot of different ways too. So we get a lot of off-label uses for aspirin for people even at a pretty relatively young age at low dose aspirin, being able to utilize that for multiple processes to actually like decrease inflammation throughout the body in general. So Tina, you ask, would high blood pressure affect your legs, ankles, and feet to swell? Tina, I'm going to get you unmuted here. Okay, Tina. So high blood pressure affect legs, ankles, feet to swell. You know, that is one of the factors, Tina, that's involved in kind of swelling both of the ankles. There's a system that's outside of the cardiovascular system. Cardiovascular system is the heart, arteries, then blood comes back in through the veins. Okay, now in the little capillaries, the little guys who are between kind of the arteries and the veins, there's hydrostatic forces that basically take effect, and not everything that goes out the arteries comes back in the veins. Okay, in that area is what's called the lymph system. Okay, now the lymph system is an extremely underappreciated system by most healthcare providers. The lymphatic system is kind of the waste system of the entire body. The beautiful thing about the lymph system is as you actually activate it and as you work it, it clears the waste within the body. So a lot of swelling that happens, say certainly ankles, things like that, movement, deep breathing, whatnot like that, it clears a lot of the lymph system. Okay, so blood pressure is one factor. Another one has to do with sodium. A lot of it has to do with actually like can have to do with kind of sodium diet choices, whatnot like that, and even there are things such as Lasix, furosemide, that help to decrease overall body water content. They're called a diuretic, and those can certainly help when it comes to decreasing blood pressure as well as decreasing that swelling throughout. So again, typically that happens with high blood pressure, and may be kind of more advanced. You'll need diagnostic tests that can kind of help give you a more accurate picture on that. Okay, excellent. And Tina, you had a follow-up there that says, I'm on water pills and potassium, but that seems to only help a little. Yeah, so the water pills that you're talking about, like, probably have to do with the Lasix and the furosemide. And then potassium, that's commonly taken along with it because whenever that medication is given, one of the side effects is that it also decreases potassium in your body as well. So being on those, it seems to only help a little. I wouldn't doubt that overall. So usually for that, Tina, you want to get more. Make sure with your healthcare provider that they've done kind of like all the diagnostic tests that you need, just to see if there's any other processes that are going on. Other natural things that can kind of usually help with that. Again, exercise is a pretty big one. Exercise is the best way outside of deep breathing to actually increase your lymphatic system. So exercising, deep breathing, huge on doing those, okay? We've even had plenty of studies now that show that if you can just get intensive care unit patients up, even if they can't even walk, get them up and get them trying to actually walk, moving them around, and just the movement in general helps to get them out of the intensive care unit a day faster. That's actually, when you look at like dollars and cents in the way of healthcare costs, huge, amazingly large, okay? The old adage of, oh, I'm sick, I need to stay in bed for a few days, that is not thought to be, usually, depending on the disease process, the best way forward anymore at all. The best thing is make yourself as active as what you can kind of tolerate. Not too much, but don't stay in bed the entire time when you're sick. That could be with the flu, that could be with whatever process. Of course, follow your healthcare provider's recommendations, but that's kind of the most recent type thing that we kind of look at. Activity levels are very good for helping out with health, not just in the ways that we think of like, like you're staying active and that kind of thing. A lot of it has to do with the lymphatic system, which doesn't have a natural pump system quite as well as, say, for example, the heart to pump everything around. So when fluid starts to pool in places such as the ankles, that's where you're getting it. That's a gravity-dependent pooling that's happening for you. All right, excellent. Okay, so Nicole, I see another couple ones. Suggestions to have regarding discussing high blood pressure with your physician. Would you develop a positive patient-provider relationship? So, Nicole, let me see if I can. Yeah, so the biggest thing you can do when it comes to like kind of a like the patient-provider relationship, have your readings and bring them. Like again, knowing your numbers and actually bringing them electronically. When that becomes kind of more available, having them already automatically routed will be even better. But like just like discussing high blood pressure with the physician, again, the white coat syndrome, that happens while you're in there. Talking to your physician, bringing in your little log. I'm telling you, the very best people that I see come into the doctor's office are usually these little old ladies that are really, really well organized. They have a little pad of paper and they have everything written down. That at 7:04 this morning, they had a blood pressure of 136 over 82. And then, like the next day at 7 o'clock, it was this. Like doctors love to see you actively involved in your care and just kind of reciprocating kind of what's going on in your care. Oh, and sorry, Nicole, you're not able to speak. Let me make sure that you're off there. So you should be unmuted now at this point, Nicole. All right, excellent. Okay, I think that's all the questions I can see right now. If anybody has any others, toss them down there. Otherwise, thank you guys so much. Thank you guys so much for attending today. I really appreciate it. Have a great day and continue going out there and saving lives. Bye for now.